you may or may not be aware, it is National Immunization Awareness Week. Parents have been sharing the But I Vaccinate hashtag over the past month as part of a campaign trying to bring more awareness to the issue of vaccinating children, which is mandatory in Ontario and New Brunswick, in order for them to attend public schools. So to speak more about this, we're joined by the Minister of Health this morning, Dr. Jane Philpott. Good to have you in studio this morning, Minister.
Thanks for having me.
All right, Canada, we know, has one of the highest rates of child immunization in the world. So, recently you've announced increased funding for immunization. Why did we need the increase?
Well, this is something that we can never let up on. It's so critical to the health of our entire population. And as Federal Minister of Health, I want to make sure that we get the message out that vaccines work, and we can't be complacent about it. We need to make sure that people are aware of the need to vaccinate, that they make sure that their vaccinations are up to date, that we encourage families, even newcomer families, to make sure that they are properly immunized to protect ourselves, our loved ones, and the people around us.
Listen, anywhere, if you want to start an instant debate, you're going to talk about immunization. It is still a controversial subject. There are groups who said, why make this mandatory? Why put all this funding into it? Why can't this be something of choice?
Well, this is something, I'm a family doctor and a mom and now Federal Minister of Health, and in all of those roles, I see the absolute necessity of making sure that we have a well-immunized population. I spent the first decade of my medical career working and living in West Africa, where I saw things like measles on a regular basis, and I saw the devastation that it caused to families. I think sometimes in Canada, we do get a little complacent about it. We've forgotten about what it was like not so very long ago when these kinds of illnesses were commonplace. Now we have the possibility to protect our loved ones, to protect our population, and we want to make sure that people understand how important that is.
Do you think that, awareness campaigns like this actually move the needle at all in changing people's minds?
Well, I think it's great that we've got National Immunization Awareness Week. It does get people talking. It reminds folks to maybe call up the family doctor and say, is it possible that I've forgotten a vaccination? Or, as I mentioned, there are populations that are under-immunized, people who have come to Canada from elsewhere who may not have gotten their primary series of vaccinations. It's absolutely essential that if people are in any doubt, please call your primary care provider. Make sure your vaccinations are up to date. It's essential, and we've got the possibility to be able to protect ourselves. People ought to take advantage of that.
All right, well, while we have you here, I want to touch on another big topic. This is dealing with Health Canada, and we're dealing with an opioid crisis in this country. They recently announced they were loosening the rules around importing prescription-grade heroin to treat opioid addiction. Some people are going to hear the word heroin, be a little bit concerned about that. Could you address that for us?
I'm happy to address that. This is something that's a huge issue now in Canada, the overdose epidemic, which is taking place primarily in Western Canada, but because of the reality of fentanyl now in cities and communities across the country, we are seeing higher numbers of overdoses than we've ever seen before. We're seeing people who have what we call problematic substance use, who have developed dependency, and we need to make sure that we have access to all the possible treatments available, including in the most severe cases of addiction, the possibility that people will sometimes need to be prescribed heroin from a healthcare provider to treat their addiction and make sure that they're not going onto the streets to buy these products that could kill them.
All right, well, most of us know by now, we've been talking about a lot, this initiative to legalize marijuana here in Canada from a health perspective. Lots to consider here. When we look to Colorado, who is a bit ahead of the game on us in here, one of the things they found is increased use of marijuana can lead to, you're a family doctor, increased risk of stroke and cognitive impairment. Are you looking to Colorado? Have you been in discussion with them there about some of the health risks or health stats that they've seen, and then weighing that into our decision here?
Well, yes, in fact, we've very much looked to other jurisdictions who have already legalized, because there are a lot of lessons to be learned. So my officials have been to Colorado. The task force went there, and we learned many of those lessons. We're facing the reality that we know that we have some of the highest rates of cannabis use in the world, particularly amongst teenagers and young adults. And recognizing that is part of why we are bringing in this legislation, bring in a strict regulatory regime to protect kids. And legalizing a product isn't to say that it's recommended or promoted, but in fact, when we bring in this regulatory regime, we will be able to protect our kids, we'll keep the profits out of the hands of criminals, and we'll be able to use a public health and public education approach to make sure people really understand the risks potentially associated with the use of cannabis, and all of this is done in the public's interest.
How to market it, how much to sell it for, those are decisions that can be made federally, but in this country, we typically leave our health decisions made to the provinces. Will you be passing some of those health regulations on to the provinces?
Well, in fact, health is a shared jurisdiction. There's a big role that the federal government has to play, particularly on public health issues. So in terms of things like promotion and regulations around labeling, for example, I think people can look to products like tobacco, where the federal government sets in place a number of rules around the fact that there should be warning labels. We're working on plain packaging regulations. So all of those lessons that we've learned from a public health perspective about how you make sure people are well informed are things that we can do as a federal government, but clearly we will be working very closely with our provincial partners to make sure that we get this right, protect the best interests of Canadians.
Good to have you here in studio today, Minister.
Thanks so much for having me.